Glad.
When I started going to doctor visits by myself, I was probably 16, 17.
By the time I was 18, it was more or less all up to me.
I'm the kind of person that I give everybody a chance. And if they're willing to listen, I'm willing to tell them about my problem and how they can help me overcome some of the difficulties I have.
When you get to be older, it's important you feel comfortable talking with your doctor and taking charge of your own health. Here's a technique that can help you speak up at the doctor's office. GLADD. Give. Give detailed and complete information on what you've been doing to stay healthy and about your symptoms, thoughts, and concerns. Listen. Listen carefully and learn all you can. Ask. Ask questions and keep on asking until you feel satisfied. Decide. Decide on a plan for doing what needs to be done to help you be as healthy as you can be. Do. Doing your part in following the plan. If you aren't used to speaking up at the doctor's office, practice what you will say.
They don't have as much time. They got to see this patient. You only get about 15 minutes for a patient and kind of get everything in. And as I realized I was being ignored sometimes, that's when I realized I needed help, and I wasn't getting through to them. So I needed to get tips, and that's when I went to outside resources to help me. So I didn't really practice. I just wrote them down, and then I've had my caseworker or a nurse that I was really close to that worked with the doctor going with me to kind of help me mediate at first, or maybe my mom or something help me, be forceful. And then after that, I kind of would practice runs with other people. That's when I got it. I was just like, I can handle this now.
If you're prepared and you know what you want to ask your doctor, speaking up is easy.
But if you can let them know by just information you've gathered and knowing that you've stepped outside of not just what they've told you, but what you've gathered on your own, then they're like, oh, well, and then also telling the doctors, hey, I want to be involved with what's going on. Don't, depends on how you want your delivery. Talk to the doctor. Tell them, once you get into it with the doctor, if time allotted, tell them, hey, I'm this type of person, try not to cover everything up with me, try to explain to me because I really want to be involved in what's going on with me.
It helps to really think about your symptoms and to practice how you will describe your symptoms to your doctor.
I think I had a headache, or, this is happening. And he's like, okay, well, describe it. What kind of pain was it? What kind of this was it? And you don't know how to describe it. So I've kind of took from what they'll say, on a scale from 1 to 10, what did you rate your pain? So I'll do that. I'll keep notes of myself. And then when I went there, these are the symptoms I'm having.
Parents can help by gradually stepping back and letting you do the talking.
Because the doctor would basically bypass me, look at me, and still go ask my mother, hey, so is she eating this? And my mother would be like, well, ask her,
It's really important to speak up at the doctor's office. And here is how to be a good communicator. Give information, listen, ask questions, decide, and do. You'll be glad you did.